Hello, happy Friday, everybody. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
And Dr. Brian Ostick.
We're coming to you from home today. We had some virtual learning, remote school obligations today, yes?
Yes, that's right.
And so we are in scrub attire, working from home, and we are going to talk to you today. We had a request from some folks to talk about COVID and pregnancy. Personally, we have several people in our lives that are currently pregnant,
That's true.
have gotten pregnant through this pandemic, and they're like our little lights right now.
Listen, it's the circle of life.
It's-
People are still getting pregnant
They
and having
are,
babies during
and
COVID.
yes, anticipating those births and expecting those little babies in our life are what is keeping me going.
Right.
But there's a lot of anxiety already around staying healthy during pregnancy, and this pandemic has put, an undue amount of stress on the expecting, and the families that have pregnant women in their lives. And what is this? So I remember, in the swine flu pandemic, I was about 32 weeks pregnant when it was really high alert before the vaccine came out. And it was very scary. There wasn't a vaccine. We knew that pregnant women were at higher risk for getting severe complications from H1N1. What do we know about COVID so far? Have you seen any pregnant women in the ER with COVID?
Yes.
Mm-hmm.
And she had very mild symptoms. I mean, she was young and otherwise healthy, pregnant in her 32 weeks, something like that.
Yeah.
And really just came in with, the classic fever and cough, but looked fine. Vital signs were normal. Her oxygen level was fine. And so we tested her for COVID and we sent her home.
Yeah. So, that's best case scenario. So it's still with this COVID-19, the way it behaves in some people versus others is still kind of a mystery. We do know that when you're pregnant, you are in a state of you are more immunocompromised and you're at higher risk for complications from viral infections. So flu definitely being one of those, and the novel coronavirus as well. If you get it, you are at higher risk for getting complications, pulmonary complications, vascular complications, being admitted, needing oxygen support, etc. So you do need to be more careful than if you were not pregnant in terms of going out, being around people that are high risk, or be exposing yourself unnecessarily.
Yeah.
So a lot of OB visits have gone, where you go every week, for several weeks at a time. Maybe some of those are being more virtual. They're not letting any visitors into these OBGYN offices. And I think that's very reasonable. We don't have a whole lot of data yet as to what it's doing to fetuses.
Mm-hmm.
I remember the Zika scare a couple years ago.
Right.
It's not quite to that level of severity.
That was a real
fetuses.
concern because that was going on in South America, and there was concern that there was an increase in miscarriages for people that were pregnant with Zika. I think that was much more virulent to the fetus.
To the fetus, right, and causing microcephaly, which is the smaller heads and things like that.
As far as I know, I haven't seen that with COVID. It seems to
Right.
affect the mom, and as long as the mom's doing okay, the baby's doing okay too.
Right. So, but there's also things called torch complexes that we learn about in medical school, which are things like toxoplasmosis, which is why they tell pregnant women not to change the cat litter. Rubella or measles,
Right.
herpes viruses, cytomegalovirus, syphilis. All those are viruses and bacteria that are really kind of toxic to the fetus if the mom gets it. And there are things that we're constantly monitoring. The OBGYNs are constantly monitoring during the prenatal phase to make sure those things aren't going on. And the novel coronavirus, at least to what we know now, hasn't shown to be that type of severity to the fetus. It's probably more maternal complications. And because of the maternal complications, the potential there, obviously you have a higher risk of things like preterm labor. So then there's a whole host of sequelae. If you do get novel coronavirus and you get very sick and you go into preterm labor, there's a lot of sequelae to the baby there from that point on.
So let's break it down. If you're pregnant right now and it's COVID going around, what can you do to protect yourself? You need to take precautions just like everybody else. You should stay away from people as much as you can. Wear your mask appropriately.
Wash your hands all the time. Keep your distances. Don't be kind of involved with a lot of high risk activities. So
the best thing would be to not get COVID while you're pregnant, right? But if you end up having symptoms like fever, cough, vomiting, something like that, contact your primary care doctor, contact your OB doctor and let them know. and then get tested, and they'll be able to guide you from there.
And the other huge piece of this is making sure you're really up to date on your prenatal care. So, being fearful of getting it does not, should not shy you away or give you fear from, seeking care, the appropriate prenatal care that you need. You find out you're pregnant, you need to engage in your prenatal care, because there's other things that you should be doing to make sure that the health of the baby is, at a maximum, in case you do get coronavirus and that baby, you've gotten your flu shot, you've gotten your Tdap, which is the basically the pertussis shot that women get with every pregnancy now. That you're getting all of your prenatal labs, and that you're not at high risk for other types of infections as well. So making sure your prenatal care is really up to date is important. To flu shot. Everybody around you, if you are pregnant, needs to get a flu shot and a Tdap.
Yep, we forced the family to get flu shots
Yes.
after we had kids.
Everybody. Yep. We don't want anybody around that baby with flu or pertussis.
That's right.
Or COVID, for
All
that
right,
matter.
wrap it up.
Thank you, guys. Dr. Amy Ostick here with Health and Healing DPC. You can visit us at healthandhealingdpc.com or call us at 818-600-2426. We're here for you, serving our community here in Woodland Hills and all over via social media. Thanks.
That's right. See ya.